Medication errors in the hospital can be deadly. There are so many instances of medication errors that happen in the hospitals every day. What are the top three ways that medication errors can occur? Number one, the medication that you're given is not meant for you at all. It's meant for another patient. Number two, it is your medication, but it's the wrong dose. And number three, you have an allergy to a medication that you told the doctors about in the hospitals, but they forgot. So these are the three top reasons that medication errors occur. So what can you do about it? Well, number one, it's really important that you either advocate for yourself or have an advocate. So when they come into the room to give you medication, you want to just make sure to ask them, is this medication for me? Make sure they double check and make sure that the patient name is actually your name and not someone else's. So that's tip number one. Number two, you can also ask them to make sure that they check the chart to make sure that the dose they're giving you of the proper medication is the correct dose. I've had so many cases where there's been a mix-up and someone gets a massive overdose of the drug. It was meant for them, but it was just given in the improper dose. And that can be avoided by simply looking at the medical chart and making sure the dosage is correct. And the third thing, what if you have an allergic reaction to a medicine? So one of the tips that I recommend is that either on your hospital door or on the bulletin board in your hospital room or even above your bed, you have them write in big letters, allergic to this particular medicine. So for example, the most common would be allergies to sulfa-based medications, which are found in a lot of antibiotics. So if you have that information readily available either on your hospital door or inside your hospital room in big letters, that way, when they come in to give you that, and if you're not awake or you're not able to advocate for yourself, it will be right there in big letters. So I hope this information was helpful. Medication errors do happen all the time, and they are the ones that can be avoided most easily with these three recommendations. Thank you for watching this video. Please hit that subscribe and like button. That way you can take advantage of all of my videos. I also invite you to come to my website at frankspectorlaw.com, where I have lots of great information about medical malpractice. Thanks again for watching, and I look forward to seeing you again on a future video.